Aziz, your mom and I will be talking about how we can help you do better in school and not get in trouble with your teachers or at home. We know that you aren't getting in trouble on purpose, right?
No.
From what I am observing today, and the behaviors you are telling me, such as hyperactivity, lack of attention, forgetfulness, talking out of turn, all these symptoms may be part of a condition called attention deficit hyperactivity disorder. It is a very long name, but what it means is that he has a health condition that affects his ability to sit still and maintain focus. It can be very challenging, but with help, things can really improve. It is as challenging for him as it is for the people around him. He is not doing these behaviors on purpose or because he wants to be bad. Aziz, it looks like you have a lot more energy than most children your age. You have so much energy, it is hard to pay attention in school or listen to your parents or teacher. It is okay, Aziz. It just means that we have to work together. You, your mom and dad, your teachers, and me, to make sure that you can learn and have fun without getting into so much trouble.
I feel a little relieved that there is something that causes him to behave this way. I was worried that there wasn't anything that could be done to help him. I know he really wants to do well. What is the treatment for children with this condition?
Psychoeducation. What key messages should you give Aziz's mother based on the presentation of Aziz's case? Explain that the child has a health condition that causes overactivity and affects his ability to pay attention. Emphasize the good qualities of the child while identifying weaknesses. Reassure the child and parents that you can help them improve behavior and learning, but it will also require their commitment and motivation. Punishment is not effective and may worsen behavior. Accept and care for the child with a behavioral disorder. Be consistent about what the child is allowed and not allowed to do. Praise or reward the child after you observe good behavior. Start behavioral change by focusing on a few behaviors that you think the child can do. Give clear, simple, and short commands that emphasize what the child should do rather than not do. Never abuse the child. Make punishment mild and infrequent compared to praise. As a replacement for punishment, use a short and clear-cut time out after the child shows problem behavior. Put off discussions with the child until you are calm. Advice may be given over several sessions and repeated to the family.
There are ways to help him at home and in school. I know that it can be very frustrating, but just as you pointed out, punishment rarely helps. Actually, for Aziz, it could even make his behaviors worse. Let's talk about some ways that may work better.
Okay, we are ready to try anything.
I'm going to focus on two things that you mentioned several times today. You mentioned that you scold him when he doesn't seem to listen, and that he has difficulty completing tasks such as his schoolwork. Kids respond much better to rewards than punishment, but the goal is to only reward good behavior. Is there anything that Aziz likes?
Well, he definitely likes attention. He likes when I praise him and tell him that he did a good job.
Great! So when you see him behaving well, such as doing what you asked him to do, make sure to pay attention to him and praise him right away. When you give him instructions, make sure they are short. And instead of telling him what not to do, tell him exactly what to do. When he completes the task, be sure to praise him and any good efforts he makes.
Okay, I think I can do that. Should I just leave him alone until he's done?
Actually, he needs even more supervision and encouragement. Long assignments will be hard for him to finish, so break up tasks into sections he can complete in 10 or 15 minutes, and give him a small reward after completing each part, like a short break or praise. Also, it is a good idea to continue having him do things he is good at, such as football and drawing.
I will. He would enjoy that. Aziz, come.
What other forms of advice can be given to carers? Praise or reward the child after you observe good behavior. Continue to encourage positive activities and build on the child's strengths. Be consistent about rules and routines about what the child is allowed and not allowed to do. Focus on a few behaviors that you think the parent and child can improve. Give clear, simple, and short commands and state them in positive terms. Minimize distractions for the child. Advice may be given over several sessions and repeated to the family.
It takes a lot of effort and time to take care of a child with ADHD. But it is important to also take care of yourself. Do you have any physical problems?
No, I am fine.
Do you ever feel depressed or extremely tired? So tired that you can't seem to do anything?
No, I am okay. I feel overwhelmed sometimes, but my husband and my sister help take care of Aziz also.
Good. I am glad that you have other people you can ask for help if you need to.
I finished my drawing. Look,
You did a great job. Thank you. Don't forget to write your name on it.
is it almost time to go? We are almost done.
Do you have any other questions for me?
No, I'll tell my husband what we talked about today too. He might have questions.
Yes, and he is also welcome to come to these visits. I will write down the things that we talked about today so that you can review it and also give it to the school. I would also like to hear from the teachers to see what his behaviors are like in school. If you could ask his teachers to write down what Aziz is having the most trouble with in school and bring it back on your next appointment, I may be able to offer advice to them as well.
Thank you so much.
You're welcome. So, just to summarize, Aziz seems to have a health condition that causes problems with attention and overactivity. Remember, he's not a bad kid, and he's not doing this on purpose. There are many ways to help, but we will need everyone to stay committed and consistent at home and at school. There are even specialists who can help if we need more support. But first, let's schedule an appointment in 1 month to see how things are going. Sure. Bye, Aziz. See you next month.
Bye.